position their arms to 90 degrees of abduction with their upper arms resting on the table. Have them contract their shoulder blade muscles, pulling them into retraction, pulling the shoulders off the table. Have them hold that position, trying to engage the middle trapezius muscle without excessive upper trapezius use. Go ahead and relax. If they're able to do that, have them do it again. This time hold it and lift the hands off the table, seeing if they're able to keep these muscles engaged. If they're able to lift the wrists, have them progress to lifting the forearms. Again, keeping the elbows resting on the surfaces. If they're able to keep these muscles engaged, they can then progress to lifting the entire arm off the table with their elbows flexed for a shorter leverage arm. Again, squeeze the shoulder blades, lift, back down. Squeeze the shoulder blades, lift, back down. The next progression would then be with a longer lever arm, so elbows extended, trying to maintain the external rotation, so a thumbs up or palm up position, and then lift the arms towards the ceiling with an emphasis on middle trapezius muscles. So really the shoulder blade muscles are pulling the shoulder blade into adduction. The next progression would then be add some resistance to this. So a yellow TheraBand can be added. It can loop under the table. And again, trying to maintain a 90-degree angle. And the motion comes from the shoulder blades. Squeeze the muscles here. Good. Have the patient lie prone with their shoulders at 120 degrees, with their elbows, forearms, and hands resting on the table. Have the patient lift their shoulders off the table, trying to bring their shoulder blades together and down towards the opposite back pocket. Go ahead and relax and pull them up. If they're able to hold this position, have them then lift their hands and wrists off the table, maintaining the lower trapezius contraction. If they're able to do that, they can progress to lifting the forearms off the table. Again, keeping the elbows resting on the table. The progression from this would be to place your hands behind your head. Again, keeping the 120-degree angle. Squeeze your shoulder blades together and down, and then lift your elbows off the table. The emphasis is on lifting from the shoulder blade and shoulder, not from the elbow. There should not be too much upper trapezius activity. The progression would then be to a longer lever arm, again 120 degrees, keeping external rotation of the glenohumeral joint, and then squeeze your shoulder blades together and down while you lift your arms towards the ceiling. We can further progress this by adding resistance using a yellow TheraBand. And keep the elbows extended, thumbs up, and again lift the arms towards the ceiling with an emphasis on shoulder adduction and depression.